Millions of people around the world have died from AIDS. And while millions more are living with HIV or AIDS, people came together at Morgan State today to create a living red ribbon to raise awareness and in support of those impacted by HIV and AIDS. 1 in 40 people in Baltimore are HIV positive, and sadly that number continues to grow. The goal is to get that number down to 0. And joining us tonight to talk about the fight against HIV and AIDS in Baltimore is Dr. Patrick Chaulk from the Baltimore City Health Department. Patrick, thanks so much for coming in.
Good evening. Thanks for having me.
1 in 40, that seems like such a big number, but you said we've made so much progress.
We really have, and I think between 2009 and 2011, for example, the number of new infections declined by about 25%, which is really, really good. And I think part of that's due to the awareness campaigns that the city's had over the years and the real strong push for more HIV testing in lots of different situations. So we now continue to have testing with the city clinics. We continue our outreach testing in vans. And for people who want to find out where those outreach testings occur, they can go to the Baltimore City Health Department website, and the dates and times and locations are all listed on that. So that's health.baltimorecity.gov. And then we've expanded testing in other settings. So a lot of emergency departments are now offering HIV testing for people coming in the emergency department. University of Maryland's offering HIV testing for all inpatients in their hospital. And we're looking to even expand that more over the coming year. So I think the combination of awareness and people getting tested has been important. And then with that, we're really emphasizing getting people linked to appropriate care. And when they get appropriate care, the likelihood of them passing the infection on to others is significantly reduced. So that's a really important step along with the testing strategies that we use.
You know, I was listening to Magic Johnson on the radio this morning, and he said it's been 23 years since he made that announcement that he was HIV positive. He said it's a blessing and a curse. Explain what he means by that.
Well, it's a blessing because he's lived so well, and he's taken his medicines, and he's taken very good care of himself. It's kind of a curse because young people look up to him and think, well, if I get infected, I'm going to be just fine. And even though the drug regimens now are very effective, you really have to be adherent to your medicines. You have to be followed up closely by your clinicians to see that you're not having side effects. So it's not all that simple, and I think he understands that. He is sort of the poster person for how well you can live with HIV, but at the same time, it can send a mixed message that, well, this may not be as bad as we think it is.
Well, as before, it used to be multiple pills. You know, now it can be as little as 1.
Yep. Yeah, 1 to 2 pills a day and really no side effects, at least not the way that it used to be. In the early days of therapy, you didn't have to take it with some medicines, with some food. Sometimes you should take it with food. It got to be a very complex regimen, and you talk to people who really took medicines in those days, and it was very complicated. Not all at once, over the course of the day. So now it's really down to once a day, and people, if they are adherent to that, will really wind up seeing that it's basically a chronic disease if you manage it well.
And you were at Morgan's for that event today, the red ribbon, the young population. Why is it so important that you reach that younger population?
Well, the young population is the fastest growing number of new infections. It's generally among the gay African-American men, but not everybody is immune. We know that about 50% of the people living with HIV in Baltimore are actually over the age of 50, partly because therapies are so good. And some new infections, we do see some seniors, really true seniors with new infections periodically. But it's so important for people to realize that you're at risk just because of the way you live. I mean, your sexual life is going to dictate what happens. We, as a health department, had a seniors and sex conference about 2 years ago, and we had over 200 seniors appear at this. And during the break, an older African-American woman came up to me and said, you know, I was married for many years to my husband, and he had cancer and struggled with it, and he lost it and he died. And I wanted another relationship, which is natural. And so she started dating some man from her church and didn't use protection and got HIV infected. So that's my story to folks that says you cannot generalize about who is and who is not at risk. Everybody is, depending upon what you do. And so that's the message around testing. Everybody needs to get tested so you know your status. And if you unfortunately become HIV positive, there's therapies that we can link you to right away that maybe will turn it into a chronic condition for you.
All right. Dr. Patrick Chaulk, thank you very much for coming in.